Okay. Dr. Zambrano, could you briefly explain the field of allergy and immunology?
Okay, first of all, thank you for the interview, Jasmine. The field of allergy and immunology is basically a field that encompasses different things. It's basically the study of the immune system, because the immune system, it helps to keep our bodies in good shape against any bacteria, viruses, parasites. Allergy is actually a subdivision of immunology. Allergy is basically the study of this, I would say, unusual response that the body can have against different antigens like pollen, dust, dander of pets, foods, etc., insects, where your body basically reacts in such a way that it can harm the own person. So it can cause asthma, it can cause hives, it can cause all different things. So that's and then the other part of the that has to do with the immunology section. It's when, for example, someone has an immune deficiency. So someone doesn't have antibodies to defend against certain viruses or certain bacteria, then the person will be obviously prone to get serious infections. So that's in an essence what allergy and immunology, both in the aspect of part of the immune system, and allergies being, as I said, an exaggeration of the immune response to our allergens, and then immunology, the study of the immune system when it doesn't do its proper job.
And since this is a project for my biology class, how often would you say that you use biology in your profession?
Every day.
Every
day, yeah, because basically every time I see a patient with allergies or immunology problems, I do use immunology. I mean, I use biology. That is, immunology is a part of biology. And you will see there is for example, every time I do a skin testing, I am using biology, because I tell the patients, okay, we're doing this to determine what you're allergic to. Thinking about mast cells and how they person have reactions to a particular antigen. These mast cells will degranulate, will release histamine. So it's all about biology. So I think on that every day.
And how did you start in the field of immunology? Could you describe your journey?
It was very interesting. Well, first of all, it came out because my whole family has has an allergic problem of some sort. My sister is allergic to aspirin. My dad has history of regular, sinus problems and allergic rhinitis. One brother who had exercise-induced asthma, and I have several of my nephews who have also some form of either asthma or food allergy. And my own son has food allergy. So it came all together based on my family experience, and then, as I said, the interest that I had in biology. The immune system being one of the most fascinating aspects of the application of biology.
So, beginning from your undergraduate education.
Oh, sure. In first years I'm originally from Ecuador, South America. So in Ecuador, once you finish high school, you apply to get into the medical school. So there I did my apply for medical school. You pass a test and a bunch of other things, and then you get into the first year of medical school. The first 3 years of medical school are we call basic sciences. That covers your biology, molecular biology, your cellular biology, genetics, physiology, pathophysiology, pathology, everything. Anatomy being the most important in the first year, histology, all those things. Pharmacology, and then your last 3 years are your clinical curriculum. Basically, you do internal medicine, pediatrics, epidemiology, anything that has to do with statistics, anything that has to do with the application of medical science into community or a patient. And then my last year of medical school, we had an exchange program we called the Latin American Training Program at the University of Miami, where I was one of the medical students chosen to do that. So I went and applied for that program. I did all my internship. I would say my fourth year of medical rotations there, where I did my internal medicine, pediatrics, OBGYN, and surgery. And then that year I worked on my doctoral thesis. So I did my work was in the pediatric immunology, especially in kids with HIV, doing a project where I was looking at the deficiency of selenium and its effect on the hearts of those kids. Usually the deficiency of selenium leads to cardiomyopathy, dilated cardiomyopathy. And then after that, I went back to Ecuador and I did my 1 year of my, it's called the Rural Medicine Social Services. And during that year, I prepared all my, took my exams to go back to the US I did take my medical boards basically, basic sciences, clinical sciences. And then I applied for pediatrics because I wanted to be a pediatric allergist. One of the things that induced me to do that was an experience I had working with a pediatric allergy doctor when I was in my second or third year of medical school. I spent a month with him and I really enjoyed it, I really liked it. And so after I, as I said, applied, I was accepted to be, did my pediatric training at the University of Illinois in Chicago. I did 3 years of pediatrics, my internship and my residency, and then I did my allergy and immunology fellowship at the University of Virginia in Charlottesville, Virginia. That to me was the most, I would say, I enjoyed so much because of number one, you already finished your residency. It's very, very tough, but this was an opportunity to do research. So that was the neat thing because I was basically 2 times a week I was seeing patients, both pediatrics and adults. We had one pediatric clinic and one adult clinic, but the rest of the time it was devoted to research. And to me that was fantastic because you were working with people who been doing this for a long time. And it was really, really fantastic because I had a chance to work with viruses. One of the projects that I worked was the effect of the common cold in asthma. So giving artificially this virus, the common cold, one of the serotypes of the rhinovirus, into the nose of these patients, volunteers with mild asthma, and studied them for 3 weeks to determine what was the effect of the virus. So that was pretty cool because you had to do all kinds of things both in the clinical aspects, seeing the patients, and then doing the experiments in the lab, trying to determine all the observations of all the different things we were doing for those patients. And it was neat because at the end that study led into a publication that actually I presented my paper in different meetings and congresses, and it was finally published in one of the journals of allergy and immunology too. So it was a pretty neat experience. I can say from a medical school, that was the part I enjoyed the most. Yeah, because I was doing what I really was looking for.
And what advice would you give for students pursuing the medical field?
I will say that medicine is a vocation that entitles 2 things. One, your love for science, where you obviously, yes, you need to be good at that, but at the same time, you need to have the other dimension in medicine that has to do with the patient and the care that you have to give to the person. So you have to have this other side of humanity that any physician should have. Be a good scientist, but be a good listener. At the same time, be a person who can have other interests in life, music, history. I think that a doctor, a physician, needs to have that well-rounded experience in education. So I think that there's a combination, I think, has to have both, science and humanity.
Interesting. So back to allergy and immunology, what advice would you give what kind of procedures would you have to carry out on a day-to-day basis?
On a daily basis, my day starts by looking at my schedule and see what type of patients I'm going to have and determine how much complexity maybe one of those procedures may entitle. I start my day with usually new patients that are basically taking the history. Most of them sometimes are simple, sometimes are more complex. Sometimes I have procedures that I have to do on a daily basis. For example, we do allergy skin testing in the patients to determine whether they're allergic, and we also do usually an assessment of the lung function with a called spirometry. And then we do a lot of procedures like food challenges, where we basically give a small amount of the food the patients are sensitive. In the case when we find that there are a good chance the patient may not be as allergic as we thought it was. So, so those procedures, especially the skin testing and the lung function, we do on a daily basis, and the other procedures depends on the day. But yes, there are some days where I see lots of patients with asthma. Some other days I see patients with eczema all day long. So it varies, and it makes it interesting because it's not that you see every single day the same the same thing. So, but the procedures, yeah, I do a lot of procedures that entitles as I said before, the skin testing, lung function, drug challenges or food challenges. Those are my main things.
And let's see. So that is what a typical day in your office would include.
Yeah, I mean, yes, and I would say I do get also sometimes consultations from the hospital. So if a patient is in the hospital and they need an allergy doctor to take a look, usually what it is usually a question about a skin rash or a drug allergy problem. They're not sure. If the patient is already been in the emergency room, they treat the patient there and they send it back to me.
So do you go on call often?
Yes. Thanks God my group is a large group, so we share the calls. So I'm not on call, but every 3 or 4 months, where I take call. But yes, we do take call, but it's an in-house call, so you don't have to be in the hospital for that. One of the good things about my specialty is that I would say 90% or more of what we do is outpatient, meaning it is not in the hospital. Other doctors spend the opposite. They spend the whole day in the hospital where most of the things are there. For me, it's the opposite. We're outside of the hospital. We try to keep people outside of the hospital.
So what makes your specialty stand out to you as compared to other specialties?
I think my specialty, what I like about it is that I see my patients getting better. And I think that if you can make someone better, it's a good reward for the doctor. Making sure that the patient feels able to do what they in the past they couldn't, like a patient with asthma. To me, that's a extremely good feeling, because you as a physician, you want to see that happening in the patient. You want to see that they get better, that they improve, that they can do what they love to do. So making my patients better is my best reward. And I think that it stands out because allergy immunology involves all the different systems. Involves the skin, involves the lungs, involves the stomach, the GI tract, involves the eyes, ears, everywhere. So it's I can do different things, even though I'm not going to be I'm not a gastroenterologist, but I deal with patients with gastrointestinal problems. I'm not a dermatologist, but I see a lot of skin rashes. I'm not a pulmonary doctor, but I see asthma because that's what allergy immunologists treat. We have patients with urticaria, we have patients with eczema, all different things. So I love that because our specialty can touch different parts of the human body, because the immune system is everywhere.
And are there any key challenges that you have to face, like in your field?
I think that in our field is learning the fact that obviously there are things that we don't have a cure for. For example, food allergy. It's obviously a field that we still feel that we are short, offering choices for patients, except finding what they're allergic and giving them the ability to treat if they have an emergency situation. But for the most part, I would say the other challenge is, well, we actually have more and more new conditions, allergy conditions, like the one condition is called eosinophilic esophagitis, where we don't have a lot of we're trying to understand this condition and we don't have a lot of medications, but they're coming through. I think the biggest challenge right now is now we have so much understanding of the molecular aspect of the immune system that now we have, in the last 3-4 years, we have new we call biologics for asthma. These are injectable medications that actually can make an asthma patient much better by treating not only the symptoms, but you're treating the immunology aspects of it. So that's when it comes down to biology and understanding how a person can get better. We can do that now with new treatments that are available. And so I think the biggest challenge is to try to understand certain diseases that we don't have a grasp. That we as doctors we can learn. We never stop learning. We always learn every day with every patient.
So So, what are some important skills to have success in your profession?
I think that the biggest advice that I will say, the skill is to be a good listener. I think that a lot of doctors may not like that, and I think it's important in your career because the foundation of anything starts with that. So if a patient comes to you, you have to listen to what the patient says. If they are coming for asthma problem, or they're coming for hive or something else, as a doctor, you need to let them explain what's happening, and you direct them according to what you think is important, but you have to listen. If you just want to come to a room and not even pay attention to that, is not a good idea. And be a good listener and also care. Be a caring person for the patient that comes to you, because they are coming to you for advice, and that is a privilege of a doctor, is be able to help someone, and be happy. I mean, I would say a doctor has to enjoy what you do. If you're not enjoying what you do, then it's really not a good thing. You have to enjoy. So I think that finding a way to enjoy every day it's important for a doctor.
So I know allergy is a subsect of immunology. What are some other subsects or specialties within immunology?
In immunology, you have, as I said, the immunodeficiencies is one of autoimmunity. Immunology, as I said before, the immune system can be a good thing to defend yourself against bacteria, viruses, and other things, but also one subsection of immunology that doesn't have to do with my specialty, but it's in the immunology area, is the autoimmunity. So, for example, there are patients who have rheumatoid arthritis. That's an autoimmune disorder.
In rheumatology.
In rheumatology. So that's a specialty, even though it's not allergy, it's part of the immune system. Because when the immune system attacks your own tissue, you can develop diseases like lupus, diseases like rheumatoid arthritis, autoimmune thyroid disease. So that's another subspecialty of immunology, is the autoimmunity. So a lot of the autoimmune disorders can be associated to other specialties. And another thing that is interesting is they're using that concept of autoimmunity to kill some tumors. There are actually applications in oncology where actually they're using immunotherapy to kill melanoma cells, for example, to destroy them. So that's another application of the immune system, trying to use the same cells to destroy cells that obviously in this case are cancerous. So their oncology in the area of rheumatology is a different specialty. Applications of the immune system, definitely there. Does that answer your question?
Yeah. And if you were to choose another specialty to go into, like rheumatology, is there a specific one that you would like to go into?
Another specialty I would have chosen, I would have chosen dermatology. It's just because I'm very observant, and I think that in dermatology you need to use a lot of your memory, because that's another skill that you develop as a medical student. Also, have a photographic memory. Once you see one condition, like a rash or something, you will always remember that. So every time when you look at it, oh yeah, I remember this patient, So I like to use I'm very visual, and I like to always keep that in mind. So dermatology would have been my other choice.
Interesting. I think I've run out of questions. So back to med school. So it was interesting because you did 3 years of...
Yeah, it's actually, there are 6 years total. So it's kind of the same. If you come from high school and you go to pre-med, you do 4. Pre-med or 3.5, depends on what program you take. So 4 of pre-med and then 4 of medical school. So you end up around 8 years. But that's just to be a physician. And then after that, you have to do your internship, residency, and then your fellowship. It's kind of the same thing, because in Latin America, you do the same. You go high school, and then you do 3 years of basic science, 3 years of clinical science, then you do 1 year of internship, then you graduate, and then you have to do the social year. So it's like 8. So it's kind of the same. It boils down to kind of the same. Probably the biggest difference is that if you have the chance of doing pre-med, you can meet the requirements for pre-med, but also, as I said, explore other things.
Mm-hmm.
You can minor in history, minor in music, and something else that will complement your education. In Latin America and in Europe, you go and you basically go to the pathway, you're 100% into medicine. I have a nephew who is right now in Ecuador starting medical school. And he was doubting also because he was asking me, Uncle, what do I do? You know, I'm not sure if this is for me, but what do you want to do? Oh, he likes research. He likes neuroscience. I said, well, you can do that once you graduate as a doctor. You can get into a PhD or whatnot, and if you want to pursue that. But there are other opportunities maybe that are more flexible in other places where once you finish high school and you want to take biology, you want to take some other classes, and then pursue maybe not medicine, but pursue basic science. Maybe you want to be just a researcher in neuroanatomy or in neurosciences. You know, there are people who specialize just in that. So that's another venue. But I think that yes, my experience was it was very interesting because once you finish, you know, high school and you were like, okay, my God, I'm in medicine. It was very shocking at the beginning. It was very a lot of study, a lot of study.
And one last question. So other than like shadowing and doing research, what other activities would you give advice to for students trying to pursue medicine but also wanting to?
I would think maybe volunteer in a program where you can actually go to see what the social aspects of medicine. So if you want to see a place where maybe not in the US but maybe outside of the US where you can actually go in a medical mission and experience what social medicine is. Basically go in an area where there's a need for doctors. I think that one of my big experiences was to go to a small town and be able to help a community there and see what's the problem the kids are having, if it's a nutritional issue or they need help to get a better treatment of their respiratory problems they may have, what type of challenges their community is facing, maybe vaccinations, maybe they don't have enough cover for vaccinations and how to solve that. So I think that my advice would be to try to get that social experience. I mean, just see what medicine, not only in the technical aspect, but in the social and human aspect. Go and look into go to another country, maybe in an underserved area, with a medical mission where you can actually feel how much people appreciate what you bring. Because a lot of times we just concentrate on ourselves and we need to concentrate on the other person that's receiving our care. And I think it's a part of medicine that will make you feel so much better as a person in general. Doctor or no doctor, you feel that you're helping. And that is a feeling that as a physician you should see, because that's what medicine is all about, is to make people better and touch lives, you know, and be always respectful that what you do as a physician, it's such a good thing, you know, that you have to remember that people trusting what you're saying and all your knowledge, but they actually care about you as a person too. When I see my patients, I do the same thing. So I think that the social aspect, besides shadowing a doctor, learning about a specialty, take the opportunity to see that social aspect of medicine. That's what I would advise.
Thank you. That's all I have.
Oh, perfect.